Hi, I'm Keith Bergeron. I'm a case coordinator on the Bone and Joint Institute's 4th and 5th floor. And this is a presentation about your time in the hospital and preparing for leaving the hospital. There's no predetermined length of stay in the hospital. It's based on your medical condition and meeting the goals while you're there. Your interdisciplinary team will create an individualized care plan to help you prepare for your transition out of the hospital. Many times on post-operative day 2, for example, you may be ready to leave the hospital. If the care team gives you that green light to go, it's because you've met your goals. Some patients have even gone on the same day of surgery, so it's all dependent on how you do. Case coordination nurses will provide clinical updates to your insurance company in order to let them know how you're doing during your hospital stay, and also to prepare for the authorization for the next level of care, whether it's going home with home care services or if you may have to possibly go to a skilled nursing facility. Now, this will be based on medical necessity. Whether or not you have the medical, the benefit is a separate topic. When you leave the hospital is, as I mentioned, based on the goals that you have achieved in the hospital. Things like how strong you are, how your muscles are performing, your range of motion of your knees, for example, how you're getting in and out of bed, how you're walking, and how you're doing stairs. There is also, we make sure that you're tolerating that activity. If you meet those goals, then you will be able to go home and have home care services. In the unlikely event that you don't, then possibly you may need to go to a skilled nursing facility for a very short rehab stay. If you go home, you don't necessarily need someone to be there with you 24 hours a day, 7 days a week. A member of the case coordination team will meet with you, usually by post-operative day 1, but don't be surprised if we come to see you on the day of surgery. We're going to review the plans that you may have thought of or planned ahead of time with your doctor, whether or not you're going home, and we're going to talk about arranging the home care services for you, which we will assist with. Again, if you're going to need to go to a skilled nursing facility, we will help with that transition plan and make a referral to a skilled nursing facility in the preferred provider network for you to go to. Before surgery, make sure that you know your benefits, your insurance benefits. You can call the number on the back of the card, but you should really be familiar with the benefits you may have for home care, for your durable medical equipment, for your skilled nursing facility if you need to go to one, and also even transportation. You have to remember, as I mentioned, that there's a difference between having a benefit and being medically necessary to use that benefit. When you transition out of the hospital, you should take into account your transportation home and planning ahead to have several different people that might be able to take you, because you're not exactly sure, for example, exactly which day you may go and the timing, depending on how you meet your goals. There's different options that you may need to consider if their transportation is a problem. There are, for example, wheelchair vans that can be privately paid. At last check, it was approximately $70 plus $7 a mile as a rough estimate. If you're going to a skilled nursing facility, those same rules apply for personal vehicle transportation or possibly a wheelchair van. In the event that you meet skilled necessity for an ambulance transport to a facility, there are things that you need to know. For example, under Medicare, there will be coverage for the first 30 miles, and then there's a 20% copay. They'll cover 80%, and there'll be a 20% copay after 30 miles. Different insurances have different guidelines and different costs associated, so if you have a private insurance, it may be more or less depending on that. The, again, benefit for a transport to a skilled nursing facility that you may have on your card, you may have that benefit, but you may need to meet the medical necessity to use an ambulance or stretcher transport. Your transition to home versus rehab will be determined by your healthcare team. That includes your doctor, your nurse, your physical therapist, maybe your occupational therapist, your case coordinator, and you. We will get together and we will have an interdisciplinary team meeting to determine what will be the safest plan for you. If you're going home and you're medically stable, you may be able to leave on the second day postoperative, for example. If you cannot meet the safety goals or you have problems demonstrating safety awareness, you are a high risk for falls, or you can't meet all of the goals to go to your home, you may need to go to a skilled nursing facility for up to 7 days. And as I mentioned, we will have a list provided for you if you don't already have an idea of where you would like to go. We appreciate your participation in a 60-day follow-up phone call. Topics included on that call from our care team will be recovery from surgery, how you did, pain management and the medication usage that you did, walking in the home, how you've been ambulating, returning to work and driving, and if you had any complications or readmissions. We also would be very interested in hearing feedback about how your stay was at the Bone and Joint Institute.